their best of their health. As we know that COVID has been creating a havoc across India during the second phase. So every day we are hearing a lot of news of losing people who are close to us. It's a very depressing situation as of now. And in this depressing situation, the parents like us are also getting scared, and we are also sort of panicking about how we are going to deal with our children during this pandemic. We have been hearing a lot of informations across people about what should be done and what should not be done. But still, we think that we should know the actual. We should get actual information. We should gather the proper knowledge regarding the treatment, the care that we need to do regarding COVID with and the child care. And to solve and to give us the query, answer all our queries. Today we have with us our eminent guest, Dr. Partha Borah, who is a senior pediatric counselor from Pratiksha Hospital. Welcome, sir.
Hello, Pinashi.
I hope everybody is at the best of their health at your end.
Yeah, all good, all good.
And how's the situation in the hospital regarding COVID and children? Are you getting news about children getting affected?
Pinashi, compared to the last time, this year we are seeing a lot of cases actually. Last time, most of the cases were sporadic. Maybe one or two members of the family were affected. But this time it is en masse. If the mother is infected, the whole all the kids, everybody is infected. And of course, the infectivity rate among children is also high this time. Although the complication is less, we are not getting very serious cases this time, but we are seeing a lot of children who have been infected with COVID this time, considered to what has happened last year.
Okay. The pandemic, since the pandemic has been very hard on everyone, and it's including children also. So during these times, what creative ways would you suggest to parents to help them explain the grim reality to their children and inculcate healthy habits?
Regarding the screen habits, you're asking?
Uh, Healthy habits in any forms.
Okay. See, these are basically difficult times, and we are seeing children who have been basically not only locked down, where they've been locked up inside the houses. So it's very difficult to control them. They are full of energy, and they always need to space. They need to work. They need to exercise. They need to run. They need to play. But in spite of those, we have to keep the children inside the houses. They are locked up inside houses. So what has happened actually is that the anxiety, the stress among the children has become high. In fact, what we have seen last 1 year is that many of the children's the accident rates have increased. Children who have come up with broken hands, fractures, injuries in their head. A lot of children because they're at home. They don't have anything to do. They're running, jumping around. So ultimately, we are landing up with a lot of problems. Of course, it's a trial time for the parents as well. So parents always they have to work out. They have to give time to their children, especially parents who are both working parents. At those times also, it's very important that whatever time it is available with us, we give it to our children. We play with them. We talk with them. Tell them stories, whatever.
Okay. And about the physical distancing and quarantine routines, some children even showed signs of anxiousness. So, what is the best approach to take to help the child cope with the stress?
See, the most important advice for parents is that if any one of the parents are infected or if the child is infected, don't put them into isolation. It's very
Okay.
difficult to keep children in isolation. Even if the child is negative and the parents are positive, consider him to be positive only. Of course, the parents can wear masks so that they don't spread the disease, but they can keep the the child along with them. Never, one good important advice is that most of the time we have seen that once the parents get infected or they become positive, they send the child to the grandparents' home. That should not be done actually. What happens after 3 to 4 days, the child will again become infected, and then they spread the disease to the grandparents or to the other members of the family. So it is very important that if your child is negative, but if both of you are positive, if it's possible, as far as possible, you keep the child along with the family only.
So, in that case, if any of the parent is in a serious condition, And will it be safe for the children also to
Yeah,
be?
see, if the parents need admission, that's a different thing. The child, suppose the parents need oxygen, they themselves are in the needed admission in the intensive care unit, then of course the other family members have to take care of them. In those cases, again, it's a difficult time because the child has to be away from the parents. He will have own emotional problems. He'll have to cope up with the other family members. These are time where everybody has to be compassionate with the child, compassionate with the family. We need to give them time, and then just let the time pass by. And as the parents recover, I think the child will also cope up.
Okay. And so, when a child has got the infection, and as you have said that we should not keep them into isolation. So, what about all the things that they touch? We cannot keep them wearing a mask all the time. The parents could do that, but what about sanitizing the entire room or sanitizing their toys? There are some certain toys or there are certain things that is not possible to be sanitized every day. So, what do you suggest during those phases? How to
See,
handle that?
if it's a there are two scenarios basically. The child is in a nuclear family where a child is staying with either with a younger or a elder sibling or along with the parents. Then, of course, the child can remain in the family. You don't need to be sanitizing everything inside the house. You don't need to clean everything inside the house. If whatever minimum thing, the normal cleaning or the normal household cleaning that's done regularly, that should be continued. You don't need to continue because already you are infected. Already the virus has entered into your body. Already the other members are also most likely getting infected, or they have the immune response through which they've been able to inhibit the disease. But of course, if you look at the already viruses survive in the for what we call as fomites. Basically, most of the viruses they can survive in the plastic as well as the stainless steel surface for a longer time. But in cardboards or in soft structures, they usually don't survive for long. You don't need to wash them or clean them regularly. Regular, sometimes if possible, you can wash them up, but you don't need a regular cleaning for all the toys or areas that the child is keep on touching.
Okay. And we have often seen that when in a family one or two person has got the infection and got the virus, and after that we do a sanitization of the house. So, do you think is it necessary to do both indoor and outdoor sanitization after a person has got infected
No,
and
see
has
what has
recovered?
happened. See what has happened actually is that we still don't know how the virus is being spread.
Hmm.
Initially, when the disease was there last year, we heard about the aerosol spread. We know that the virus was the small particles that could remain suspended in the air for around 2 to 3 hours, and after that, the virus usually dies. And this virus can survive in certain surfaces for a longer time. This is what was our idea about the virus. But this year, with the mutation of the virus, we have come to know that this virus can spread through air also, and it can go up to longer distance. And most of the infectivity that is happening this year is through the droplet infections, basically through the airborne infections. So what happened actually by through sanitization when the parents are infected or the household is infected, our main idea is to stop the spread through the aerosols. So it is important that we sanitize the area as well as sanitize the whole, at least the around the corridor or if you're staying in an apartment, the lift, all those areas where the parents would have come up or the common area which is mostly been used by other people also. Those areas should be cleaned or sanitized.
Okay. Um, so, what small changes can parents make in their daily routine to develop a healthy and safe space for the children at home during this pandemic?
So this is basically it's not developing a healthy habit during the coronavirus time. You start developing healthy habits right from the beginning. It is as the parents who needs to develop a healthy routine, healthy habit, so that we can inculcate those same habits to our children also. Waking up early in the morning, making up our own bed, brushing our teeth, having a bath, all these things. But children always follow their parents. If you are sleeping late and if we ask our child to wake up early, he'll never do that. If we don't exercise ourselves, our children will never exercise. So it is a routine that the families follow. If the parents are following those healthy routines, the children will always imbibe those habits and they will always follow the healthy habits. So it is important that we always carry on with the good habits, not only during the corona times, it should be our daily routine practices so that our children follow the good habits.
Okay. So, before going further with the more questions, I just wanted to ask you a little, if you can just explain a little bit about what coronavirus is all about, And since we know that how it has been spreading a little bit, definitely we are knowing about it. But what it is all about, what is there? Is it anything? Is there anything to be scared of? Because we all are sort of panicking currently.
See, what we have seen is this is what is called as pandemic. We have never seen an outbreak in our life. This is the first outbreak most of our generation has come into. What we have seen or heard about is the Spanish flu that is read about, and the first the outbreak that happened in the 13th century was the bubonic plague. This is the first pandemic or the outbreak where we have actually seen and we have already faced. See what these are basically all these viruses. They always undergo mutation, and this is what is called the SARS-CoV-2 virus. And this virus is a message, what we call is a single-stranded messenger RNA virus. So these viruses they undergo mutation. They have come from the animal world. It's called zoonosis. They come from the bats as well as from the pangolins. So it has traveled all the way from Wuhan city from China to the and just gone across the world. Now what has happened is that this virus it can travel through either we have discussed, it could be travel through aerosols, as now we have know that it can transport through air and through droplets. Now what happens actually with this virus basically? Once the virus enters into our body, it can enter either through the nose and through the mouth, and it lodges itself in the inner part of our nose, in the nasopharyngeal area. As well as there are certain studies which have shown that the virus can in fact enter through the conjunctiva as well, the eyes. So there is another route. So once the virus enters into our body, it binds to certain receptors in the body, and then it sets up its own reaction. Basically, if you talk scientifically, there are basically three phases that has been described. One is that the virus has entered the body, which is a febrile period. Then there is a pulmonary period. First, usually, once the virus enters your body, it takes around 4 to 17 days, 14 days for the virus to develop symptoms. So once the symptoms develop, the initial symptoms could be either fever, body aches, loose motion, vomiting, normal flu-like illnesses. Then after 7 days, usually the lung symptoms starts appearing. Lung symptoms like difficulty in breathing. Sometimes you can have hypoxia where you need oxygen. You can have fast breathing. All the symptoms starts appearing. And after 14 days, usually the hyperimmune response starts developing. This is which is the most critical or the crucial phase of the disease, where we see most of the deaths or the complications from COVID. But in the hyperimmune response, the body starts developing, goes into shock. It affects the liver, it affects the cardiac system, it affects the vascular system, where it is called vasculitis. And where there is, we call it as thrombosis. There is blood clots happening inside the blood vessels, as well as it blocks the smaller blood vessels, resulting in the various complications that we heard or we hear from the COVID virus. Most of the time, this virus actually survives in the human body for around 7 to 14 days only. And after 14 days, usually the virus dies out. And whatever the viral load or the that we hear from the RT-PCR, that is usually sometimes from the after 14 days, it is mostly from the dead viruses. So usually the infectivity period is between 7 to 14 days.
Okay. So during this 7 to 14 days period, so if a child started recovering from that 14 days, so what are the post COVID care that parents or the parents are need to take for the children?
See, COVID as usual it's a viral infection. So most of the time, most of the viral infection they subside in its own, and usually it doesn't cause any complication. We have seen if you see the Indian data, the ICMR data, the recovery rate is almost more than 80 to 90%. Only death rate is around 1 to 2%. So if you look at the recovery rate, that means that most of the people have overcome the disease on its own without any treatment. So most of the people will have an asymptomatic phase where maybe they haven't shown any symptoms. Now the thing is that why some children will develop complications is very difficult to say. But in children and especially in adults also, what we have seen is a newer complication, what is we call as MISC or multi-system inflammatory syndrome, where post-COVID there is a hyperimmune response of the body, where the body reacts to its own system, own vascular system. It produces certain reactions inside the body, and which results in complications. Like in children, what we have seen, Once the child is recovered from COVID, sometimes the child can come back with high grade fever again, fever lasting for more than 5 days. They can have redness of the eyes, they can have redness of the lips, tongue, and along with rashes in the body. Sometimes they can, along with them, sometimes they develop bleeding also, bleeding in the eyes and other symptoms like they can have involvement in the cardiac involvement where we call it myocarditis. Some children may come up with pneumonia and some can have renal complications also, which can occur in later part of COVID. So it is very important. The most important thing about COVID, if you look at the nutrition part, the most important is hydration. You need to give a lot of fluid juices to your child so that they don't get dehydrated during this period.
Okay. And during this period, like when a child has already succumbed to not succumbed, sorry, the child is already got infected with the disease. So, what is the diet they need to follow during that 14 days phase?
See, if the child has become positive, now what is the most important thing again is the diet, as you have said. So the most important thing is that the child can have a normal diet intake. Usually, what is recommended is the high protein diet. The child, if the child is a child is taking non-veg food, then he can take fish, chicken, and continue with other food proteins also. Second most important thing is good hydration. You can give him fluids, ORS, juices, milk, everything. The most important phase of diet is in children who are less than 6 months of age or children who are less than 2 years of age. These children who are breastfeeding, you should continue with breastfeeding. If the mother is infected, and suppose the mother, it's a newborn, and the mother has become positive after delivery, this child should not be separated from the mother. As far as possible, we'll advise the mother to continue with breastfeeding, so that the child gets the adequate nutrition, child get the adequate whatever immunity the mother has developed, the child gets it through the breast milk, and this is in another way, it's going to be protective for the child. And we don't want to separate the child from the mother as well. But of course, the mother doesn't want to keep child along with keep the baby along with her. Then of course, a different thing where we need to give them some other milk. But as far as possible, we'll advise mother to continue with breastfeeding during this period.
Uh, so, what about screen time? Since during this pandemic they don't have anything else to do, so most have turned to online classes. So, should parents find alternatives for cartoons, and how to convince the child to ease off it? Like it's comic books can be an alternative, but some children it might have the same does not have the same charm as visual representations. So, do you think the screen time it's okay with the children
See,
to watch?
screen time always will depend upon the age of the child. Children, of course, who are less than 2 years of age, it's an absolute no. We should not put them into the screen because this is the period when their cognitive functions are developing, their audiovisual functions are developing, and if you put them into the screen, the cognitive ability comes down. So the children will, there's already a lot of research which have come up, and the American Academy of Pediatrics and also the Indian Academy of Pediatrics say that the children below the 2 years of age should not be advised to look into the screens. For children who are between 2 to 6 years of age, because they are into schools now, most of the schools they have some online classes. Usually 1 hour is what is advisable. Apart from that, it's very difficult for the parents. I can understand to give time to the children. Most of them are busy, but again, we should not allow the children to be on screen all the time. We can fix a time for them. Suppose we make a routine for them that you do your homework, you do your play, and for that you get as a reward you can be advised to take look at the screen for half an hour, but not beyond that, maximum 1 hour. But again, as parents, we need to always, it's just like driving. You don't allow your child to drive a car on its own. You'll teach the child to drive. So as you need to teach your child to look at the screen also. You should be monitoring him, what the content he is watching, and whether it is, you should not be allowing the child to look at the cartoons all the time. Sometimes certain programs could be helpful for him, where there could be interactive sessions where he'll be playing some games might help him, some interactive games, but it's not that we should be playing or watching mobile or the cartoons or the all these different programs that come up all the time. It has led to many problems. We have seen children with hyperactivity. We have seen children with speech delays who are mostly glued to the screen all the time. Third common thing that we mostly see, and if you look at the adolescents, this is the most difficult population to manage. Children who are more than 9, 10 years of age, they are not in the schools, they are out of their friends, they cannot they are just they all the time they cannot be on the studies. So this is and they are mini adults as well. And so it's very difficult to control this adolescent who wants to be on the Facebook all the time, on the Instagram. So sorry. So we need to monitor the adolescent group as well, so that it doesn't affect their mental ability as well as doesn't influence their psychological abilities as well. Because we have seen children with a lot of psychological illnesses, especially in adolescent age group, where they've spent more time in this screen.
Okay. So, the pandemic has the risk of making children socially inept. So, any suggestions on how to work on this?
See, our children are, I think they've already become socially inept now because it's a nuclear family. We don't go out, we don't play, we don't have a society as a whole where the children could be mingling around. They don't have their own age group children in the same place. So the school was the best place where they could mingle around and where they can play, where they can talk. But when they're at home, there's always a generation gap which works. But even as parents, I think we'll advise to be, and when we are as parents, we're there, we should play with the children. There's a lot of group activities that we can do as parents with the children. A lot of things. We can play hide and seek. We can play stories. We can play what do you call it, parallel play, like cooking items. You can ask your child to help you with your daily chores. Ask him to make her bed. Take out the clothes from the laundry. Everything, anything, wherever the child is helpful, child can help you. All these things can be asked for. Of course, talk to your child. The most important. Whatever is there. Conversation is very important. Healthy conversation is very important. Even parents conversing among themselves is also important. The father and the mother are talking among themselves. That the child listens. That also makes the child happy. The child can learn few things from them. Of course, telling stories always plays a role. Bedtime stories or anytime, whenever you're there, you're petting your child, hugging your child, talking with your child. And of course, talking about screens, of course, most of our family members are staying in different places. They're away from their family. You can always ask for video chats with their family members. This is again going to give a connect to the family members, to their parents, to the grandparents, so that they can talk, they can play, and they can learn few things also.
When you were talking about the storytelling part, it just reminded me that I have become a walking storyteller for my daughter because I have tried to put that habit so much into her. Like whenever she sees my face, it's like, tell me a story. So sometimes it gets
That's a good thing. That's a good thing. Actually,
it's very
children.
tiring at times, though. So
Very
any,
good.
so uh, does medical history of a child will put them more into the risk of getting COVID if they have any medical history?
See, we have heard about this word comorbidities. So children also have comorbidities. Children with congenital illnesses, children with congenital genetic disorders, children with congenital heart diseases, asthmatic children, certain children who have got congenital lung problems like cystic fibrosis and other pulmonary primary ciliary dyskinesia, as we call. The children with low immunity, children with who are HIV infected, children with immunodeficiencies. These are children who always were more to get this disease and they can have serious illnesses. Children suffering from malignancies, children who are on chemotherapy, there is always a high risk of getting corona infections.
And so we are often hearing the word oximeter that we need to use it at home. So when it comes to children, so is that oximeter of any use for the children? Can we do the measurement in that oximeter?
See, I think the most important gadget that has come to use in the last 1 year is this oximeter. Every morning we receive around 4 to 5 pictures in the WhatsApp and parents showing the different SpO2s and heart rates. That is my child okay. See, one thing is that we need to look at symptoms rather than looking at the oximeter readings. We need to see whether the child has got symptoms like fever, cough and cold, or the child has got any breathing difficulty, any respiratory issues, and of course we need to monitor his oxygen saturations. See, oxygen saturation sometimes what happens. The most important thing is that how do you place this oximeter into your baby's finger?
Exactly.
The most of these oximeters, these are basically adult oximeters, and if you look at the oximeters, there's a red light which is beeping inside the oximeters, and this red light has to fall into your nails and basically under the nail bed, so that this red light is going to pick up the signals from the blood vessels, and from there it's going to pick up the oxygen saturation actually, and as well as the heart rate. So if the nail bed is not touching the red light, it will not be able to pick up the saturation as well as the heart rate properly. So most of the time, what happens is the oximeters, they cannot go inside into the nail beds, and they pick up false SpO2 as well as heart rate. So there is a time when where the parents panic. I'll just give you an example. Just few days back, one at night, one mother just we just had a frantic call. The mother said, "My baby has got a problem. Her SpO2 is just 60%. She's playing, she's running, but her oxygen level is really down. I think I need to go to the hospital immediately." It was very difficult for me to convince her because her SpO2 was saying 60%. Anyway, she came to the hospital into our emergency, and we could put her into a normal saturation meter, and it shows 99, and she was very happy. Oh, my child is okay now. So this is what is actually happening, and mothers are not only mothers, most of the parents there. These are situations where you tend to become panic, and when you're hearing all those bad news every time of deaths and so many complications, you tend to panic. But even then, for young kids, especially if your child is less than 2 years, you can put the oximeter into the toes also, which will enter, which will clip to the toes properly, or you can use any of the fingers to pick up the oximeters. Again, when to panic? Usually, we don't have a normal SpO2. Suppose what is a normal? Basically, 99% is the normal SpO2 in most of the children. But what is said in children is that your children SpO2 is less than 93%. That means the child has got hypoxia or his oxygen saturation is falling down. So in those cases only we need to worry, or we need to come to an emergency. We need to look at the doctor, see the doctor. Of course, along with SpO2, we need to look at the other symptoms, like whether the child is having breathing difficulty, whether he is breathing fast, or whether he got sick, whether he is lethargic. All these things also we need to look at.
So one more thing is like